Okay, I want to talk to you about our digestive enzyme that we've upgraded the formula over the last few years. We're always constantly making our formulas better, and we have a new digestive enzyme formula called the upgraded digestzyme. And digestive enzymes are one of those things that do not get a lot of attention, right? I mean, they really don't get the same kind of attention as some other supplements, yet is a critical and very important aspect of returning to health. What are some of the symptoms that somebody will have that indicate that they need to take digestive enzymes?
Well, anybody that has acid reflux, need to take digestive enzymes. And the reason that people get, they often get this wrong, and I really get frustrated by, the traditional treatment for acid reflux. When you have acid reflux, there's a couple of things that are going on. Either you have elevated insulin levels, or you're not making enough acidity in your stomach.
Which is funny you mention that, because it's always, the traditional treatment that you get today is that, well, we better give you some kind of medication that turns off those hydrochloric acid pumps so you stop secreting it, which really is ultimately completely just covering it up. I mean, it's, you mentioned it's, generally they have low acid, not too much acid.
So the body's just trying to make more, so then it sends it up the esophagus, right?
Now, before we go on and mention quickly what are some of the side effects of turning off those hydrochloric acid pumps.
Well, obviously now you're not going to be breaking your food down very well, right? So now you're not going to absorb certain things, right? So what they're finding is when you take these, what they call proton pump inhibitors, you get osteoporosis, you get fractures.
And that's a fact.
People's jaws have fallen apart.
That's incredible.
Unbelievable. But I mean, what else is happening? They're obviously never in. It would be an impossibility if you're taking one of these things that you would be able to absorb B12. This is one thing that we see so much in our office is a lack of B12. It's almost like it's universal now because
it's
people.
Pretty consistent.
Yeah, because if you have any kind of digestive issue whatsoever, you're not absorbing B12.
You're
so these
B12.
digestive enzymes would be helpful because first of all, they help to increase your acidity where it belongs, right in the stomach. They take the place of that hydrochloric acid, and they break down your foods for you. With our high levels of lipase, amylase, protease. Those are all enzymes that your body needs.
So bloating is a big symptom. Heartburn is another big symptom. Leaky gut syndrome as well. Not only do you have to repair that with probiotics, but you need digestive enzymes as well to break that food down while the stomach is healing itself, right? So you mentioned a few things. Our digestive upgraded formula has a lot of lipase, protease. It has all the enzymes that help you break down the different types of macronutrients that you consume. Also has in there some stuff that helps you digest in the late stage digestion, which gets rid of the end, some of those difficult fibers that people have a hard time digesting. A lot of people get a lot of not only bloating but gas because of different fibers and stuff like that, where these enzymes will help you get rid of that, help you correct digestive issues. What are some of the things that people notice once they start taking digestive enzymes?
Well, less bloating. They find, even funny, I mean, I've had a lot of patients tell me that's really helped them with weight loss. Because now they're digesting their food much better. They're able to eat a lot of things that at one time they were not able to eat. A lot of times just that acid, not coming up that esophagus, and especially if you're going to have a heavy meal, enzymes are absolutely essential. A lot of people don't realize the importance of taking enzymes. If your body doesn't have it, you better be taking it.
Now, we recommend taking digestive enzymes before a meal. However, for people that have bad digestive issues, take it before the meal and then take some after the meal as well. We get very good results in our clinic by doing it that way. Well, we want to thank you for watching this video. If you have any question on digestive enzymes at all, feel free to email us at info@martinclinic.com.